So this pad is the pad that the EMTs bring patients in on. Limitations on these pads are, again, they're more narrow than the others. They have a grippy texture to them, so they don't slide on tables, they don't slide on sheets very well, and it's a whole lot harder to pull the patient over, especially if you're having to do that with minimal help. So the sheet almost always comes with the patient, so that gets caught up underneath them for when we get them over, and it's just a lot harder to pull over than it is with the other pads.
A little bit of a bump. Ready? 1, 2, 3.
Going back the second time, I felt much more secure going there on the board.
Okay.
When I was lifted up like that, for a minute you're like in a little, hammock almost. And yeah, so I much prefer the first method of transporting from the gurney to the CT.
And Doug, how was your transportation experience? Was that easier with the?
It's tough on the back.
Which way?
With only the sheet.
Okay.
And then they roll right off and they're not on top of it, huh? All right, so in 1, 2, 3, we're just gonna come up this way. All right, coming down, 3. Yeah, and just keep your hands on your chest and 1, 2, 3.
And then that comes out. In Baker City, the nurses put these pads under almost every patient. The limitations on these pads are that they're not padded, there's no padding in them, so we can't use them in x-ray all the time because we don't have the padding. Second of all, they're a lot shorter and a lot narrower, and we have problems with patients even being on them when we're ready to pull them over. We always have to change the patient on the pad in order to keep them on it when we transport.
So the pad is put on the table before the patient arrives.
Yes.
So we're going to put Phil on this beautiful red ER pad that they ordered.
This is a scarlet for the Buckeyes.
Okay. Now, we're not going to have Dennis there because most of the time we only have one tech on graveyard shift. So this is how the red pad feels.
So good handles. There is a bump coming over because of the hard board in there. So that's kind of what those feel like.
Okay.
We run the risk of that hard plastic board catching the side of the table or catching the CT table, which is more bumpy for the patient and has more pain involved. So these are the pads that we would like to get. They are padded, about at least a ½ inch thick. They can stay on the x-ray tables for every patient that we do because it provides padding for the x-ray table. They have a nice thick nylon to them and they slide, which makes them slide a whole lot easier than the others that we've shown.
Okay. And these are put on by the ER staff before the patient gets here.
Yes, if we have these, the ER staff puts them under the patient, and we found that they're a whole lot easier for the patient and a whole lot easier for the tech. So, again, I can slide very easily over to this table here without pulling the mattress, without pulling the sheet as much. It's just more
Less resistance.
less resistance and easier to pull.
And then you leave that pad underneath the patient during the whole
The whole
scan.
time, and then pull them back over when we're done.
Okay.
As a patient, I could notice this was a lot softer. Those bumps were cushioned, they were padded, versus the other ones were more abrupt.
Yeah.
As I was getting pulled over.
Yep.
So which one would you pick as a patient?
Yeah, of all of them that we've tried, this one for sure is the most comfortable, and it feels it's just less jarring, as a patient being moved from one